So, good morning, good afternoon, and good evening to everyone. Thank you for joining our session today. My name is Mackenzie Francis, a member of the Regional Secretariat. On behalf of the Regional Board, members of CariMAN, I welcome you all to today's event, which will be moderated by Tivia Collins. Tivia Collins is a PhD candidate at the Institute of Gender Studies and Development at the University of the West Indies, St. Augustine campus. She currently represents CariMAN on the MenEngage Youth Reference Group, and she's a member of the CariMAN Regional Advocacy Working Group. So without further delay, I hand it over to Tivia. Thank you once again for joining us.
Good morning, good afternoon, good evening, everybody. Welcome to the third MenEngage Global Symposium, which is titled this year, the Ubuntu Symposium. And today we're very delighted to have all of you here present with us. And what we're having today is the regional roundtable session for the Caribbean. And today's session is titled Compounded Inequalities, the Gendered Impact of COVID-19 in the Caribbean. Now, gender is such an important analytical framework when we're assessing the impact of socioeconomic, political issues, economic issues at all levels within society. And so today we're going to be specifically focusing on how COVID-19 has affected us within this region. And the effects, of course, have been severe and have varied across sectors. And specifically today, what we're going to talk about is its effect in relation to sexual and reproductive health rights, gender-based violence, regional climate responses, and gender equity. Now, these topics, of course, are all compounded and all have, varying degrees of effects on the region. And experts, as I call them today, are going to present on that. So I do hope as you join us and as more people come into the room, of course, we're starting promptly at 9 a.m. I do hope that we have such an enriching conversation today as we walk through and action ways to ensure an inclusive and a resilient recovery for this region that all of us love so dearly. Now, before I begin by introducing the speakers, I want to just get a little bit of the housekeeping out of the way. So our talk today is going to be for about 2 hours. And as the presenters share, I'm going to ask you to please feel free to post questions in the chat or even comments that you have so that we can engage in a conversation after each presentation. Now, during the questions and response segment, I will get straight to the questions that you post and invite the presenters to share. Also note, our first speaker, she only has, unfortunately, an hour to share with us today. So when the first speaker presents, I would ask you to post your questions to her right away. And after we get to the second speaker, I'll pause, take a moment, we'll deal with questions for the first speaker, and then we'll continue as planned for the program. So I know you didn't come here to hear from me. So without further ado, I'm going to introduce all of the speakers for this morning's session. The first speaker is Tawny Ann Brodber. She is the representative for the UN Women's Multi-Country Office, Caribbean. Now, prior to her appointment in August 2020, Mrs. Brodber served as deputy representative from 2015 to 2020 with the MCO Caribbean. Before this, Mrs. Brodber was the team leader for the Advancing Gender Justice in the Pacific program with UN Women Fiji Multi-Country Office. Her work experience also includes lecturing in international relations and development at a university in China and directing and co-producing a film, Haiti. That is Mrs. Tawny Ann Brodber. Now, the second speaker for today is Pauline Russell Brown. She is the Family Planning Association within Jamaica. She's the head of it. Now, Dr. Russell Brown holds a doctorate in public health and a master's in social work. She has a depth of experience in public health and education and has several publications in peer-reviewed journals. Among her work is the Health Advisory Committee Toolkit and which provides practical tips and tools to support schools and education administrators in planning and managing a work plan of HIV and AIDS prevention education activities for the entire school community. So we welcome Pauline Russell Brown. Our third speaker is LaFleur Kwame. She is in the Ministry of National Mobilization in St. Vincent and the Grenadines. LaFleur is the Senior Assistant Secretary acting within the ministry and she provides administrative and technical support to the Minister and Permanent Secretary. In 2017, she was instrumental in the establishment of a Gender Equity Commission and that provides national oversight and advice on gender equality to the Minister with responsibility for gender affairs. She's an advocate for the advancement of women and gender justice, and she's well placed within the ministry to ensure that gender equity is promoted through policies, programs, and other interventions where men, women, boys, and girls are provided equal access to opportunities. The floor, we welcome you. And finally, our presenter for this morning is Vidyarath Kisuun. He is a gender equality advocate within Guyana. Vidyarath lives and works in Guyana and is concerned about gender equality, child protection, and equality for the LGBTQI+ community. He has years of experience in social justice work. I would like to add that he's one of the leading activist voices within Guyana, working towards creating a gender-just society. So welcome all again to the speakers. As you know, they're from across the region. We have Jamaica, St. Vincent, Guyana, and Barbados. So without further ado, let's get this conversation started. So I want to begin by inviting Tawny to start the conversation on a gendered overview of the impact of COVID-19 within the Caribbean. So Tawny, as we think about the regional commitment to advance gender equity and the challenges specifically that women experience, and we know that these challenges are vast, which includes the gender division of labor, unpaid care work, all of these things which we know have been exacerbated since COVID-19. What information can you share with us from your office about the social impact COVID-19 and the gendered impact really COVID-19 has had on the lives of women and men within the region?
Sure, and if you don't mind, I know it's a conversation, but sometimes PowerPoints give a very, very good explanation and visual way in which to see some of the data and statistics. So I want to make sure that there's an understanding that, of course, COVID-19 does not necessarily have bias in and of itself. It is exploiting the biases that already existed in the Caribbean. It has impacted everyone. And in fact, men died the most from COVID-19. This is something in terms of life or death you'll see. And this may have something to do, we need to discuss it more, we need to look at the data more and get some more interviews in terms of qualitative research, with the fact that before, men were not necessarily encouraged. And when I say encouraged, I mean in terms of the way in which our society tells men that strength is in being someone who is resistant to vulnerability. That men were not necessarily encouraged to take care of their health or to see a niggling cough as something that you need to take extremely seriously. And so this is one of the reasons in which we may have seen that result of more men dying. What we've definitely seen is widespread and unfortunately unequal job loss. Both are unfortunate, both the widespread job loss and the fact that it's been unequal. Because we'll see, and I'll show you in a bit, a lot of the losses came from persons who are domestic workers. The majority of domestic workers are women. The majority of the persons who work in the services industry are women. And the majority of people who work in tourism in the jobs that are based on the short-term work cycle are also women. So women, because they had a heightened vulnerability and economic insecurity, that was exacerbated as a result. If you can see from these slides, you'll see the job losses by sex, and you'll also see that there was just a decrease in overall well-being. Those who work in the informal sector, again, the majority of whom are women because they are the most under or unemployed, recently were not able to make a livelihood as a result of the pandemic, the reaction that a lot of countries had to take to the pandemic. But one of the barriers or challenges to women's economic empowerment for a very long time has always been that unpaid care work burden. The fact that you do your work, the formal work in the office, and then in the mornings and in the afternoons, You're dealing with preparing food, cleaning houses, taking care of your parents, taking care of your family, taking care of your children. And what we saw as a result of COVID-19, because of the lockdowns, we saw that women had an increase of 68.5% women reporting an increase in homeschooling their children, entertaining their children, cooking their children, cleaning and caring for elders, all increased. All, if you see women reported an increase of over 50%. These women, 50% of women at least reported an increase in doing this kind of unpaid care work, where in general, most men did not have the same kind of an increase. They did not report as much of an increase in doing this work, except around caring for elders, which is a critical thing that we should note as well. We know intimate partner violence in the Caribbean is too high. We need to get the data now for St. Vincent, right? Like the floor, we need to get that prevalence survey data in St. Vincent and the other Eastern Caribbean countries as well. Across the board, it is too high. We have 55% in Guyana, 48% in Suriname, 44% in Trinidad and Tobago, 39% in Grenada, and 39% in Jamaica, at least. What we know is that the home has not always been a safe space for women and girls. And now you are confined to your home. And so what we've been seeing is that as a result of the pandemic, or we can't say as a result, but what we can say is since the pandemic, we've seen a 149% increase for year-on-year calls to the Domestic Violence Center in Trinidad and Tobago in June of 2020, a 125% increase in March of 2020 for Anguilla, and a 38% increase during the first lockdown in 2020 in Barbados. And this is the thing with COVID-19, is that the data keeps evolving because we do a rapid assessment in 2020, then we go into a second wave at the end of 2020, early 2021, and we're going to see how that has really affected persons as well. So what we're seeing right now is that that is the general data around the circumstance. And we know that governments have done a lot to try to address these challenges that were expected because these inequalities existed before. So I'll leave it there because I'm sure you have another question.
Thank you so much. I really, this data is troubling across the region. And what I don't know if anybody has any questions in the chat as yet, but I want to ask you, because I know, and as I shared earlier, I just want to reshare with everybody, Tawny only has with us an hour today. And so what we want to do is if you have questions specifically for her, that you ask those questions now, because at 10 a.m., unfortunately, she is going to leave us. But my next question for you is, what response measures do you think need to be included at the national level, community levels, even at the regional level? Like what do you think right now has to happen among states and within our communities for us to deal with these types of challenges in the region?
Sorry, I'm laughing. This is the refrain of 2021. Don't forget to unmute your mic. Yes, I think that what has to happen is there are two things. There's certain things we have to do immediately as part of the relief and as part of our recovery plans. And I think relief-wise, we've done as much as we can, and it's not just UN Women, it is the UN agencies, it's the governments working together to make sure that those who are most marginalized had food packages, they had stipends, they were able to get some relief in terms of liquidity, some cash in their hands to be able to eat. When we tell people stock up for 3 weeks, that's an assumption that people have that kind of money on them to be able to stock up for 3 weeks, much less 3 months, right? So these are things we need to be thinking about in terms of immediate relief. The recovery efforts are more long-term, and I think those recovery efforts have to include preparedness. Like any disaster risk management system, we need to be thinking, were we prepared for a hazard? And the truth is, whether it is a pandemic, flooding like Guyana is experiencing right now, or a hurricane, which let's hope we do not have to deal with this year in the region, or a volcano, like LaFleur will be able to tell us about, Are we prepared for the impacts? And generally we're not, which is unfortunate given that we are in countries and in a region that will experience one of those things, not necessarily a pandemic, but definitely flooding, a hurricane, and we have active volcanoes at least once a year. So how can we make sure that our social protection systems are gender and shock responsive? How can we make sure that the tools we use to collect data when people enter into a shelter, take the sex disaggregated data, take the age disaggregated data, so we aren't waiting for months to figure out where the women are, where the men are, how old are they, where are families, and how can we support them? How can we make sure that referral pathways are established before a hazard so that when someone experiences violence during a hazard, they know where to go and they trust where they can go to receive that support? Where are we in terms of ensuring that the shelters, not only the shelters for persons who are survivors or victims of gender-based violence, but those, and when we talk about gender-based violence, there's so many different forms. I'm speaking specifically about intimate partner violence, but where do we help people who are victims of incest and child sexual abuse and sexual assault? Do we have specific places for them outside of the shelters that we provide for persons who have intimate partner violence? And then what do our hazard-related shelters? Are they shelters that you can have people in for longer than a month, 3 months? How are we making sure that they are safe when a hazard actually hits? A lot of this work has to be done before. But since we're here, we need to make sure that we're collecting the data, analyzing it. We need to make sure that when the policies are put in place, those immediate relief recovery policies, we're thinking about those who may be left behind, the unbanked, the people who have not necessarily contributed to NIS, but are deserving of some kind of social insurance. How can we support those people? And then the last thing that I think is a critical aspect of it is our ability to work with our communities on mental health and well-being. So many, we have some data that we'll be able to share soon from Trinidad and Tobago, where a lot of men are just talking about the ways in which they have been trying to cope with the mental stress of COVID, with the fact that they're no longer able to provide for themselves or their families, the additional stress of having to take on parents, and a lot of women, how they cope by not dealing with it at all, by just working, doing, the strong women, Caribbean women providing for their families. But you ask one question and they break down. How is this affecting their relationship with their partners, men and women, each other, or children? That how are we managing our mental stress in a healthy way, in a way that brings on board the professionals? It's great. We do need our faith-based organizations that give a lot of people relief, but we also need to lean on the psychologists, the psychiatrists, the certified therapists that have the skill to be able to assist us in managing these kinds of events. The last thing I want to say, because I don't want to take up too much time, my uncle is Trinidadian. As many of you know, I am a Caribbean woman, Trinidad, Jamaica, Bajan, a little bit of Grenada in there, right? And my uncle, in a true Trini way, because I was so stressed out when the cases in Trinidad went up. I have a lot of elderly family in Trinidad and Tobago. And he say, oh gosh, girl, it's normal. Look, we had a pandemic before. We had everybody, we had hurricanes, we have volcanoes. It'll come and it'll go. But when we're in the middle of it, how do we manage the understanding that it will come and go? Some of us will come through it in the same way or even better than we entered. And some of us will not unless we get the kind of mental, physical, economic support that is required for all of us to be able to really thrive and build back and build forward equal from this pandemic.
Thank you so much, Tawny. And I want to ask you one more question before we go on to the next speaker. And I'm thinking about this a lot, especially because when you spoke about the issues of mental health challenges or even poverty issues, socioeconomic challenges within the region. You didn't mention as much, but there are also state policies that are not being implemented effectively as well to manage these types of issues. Are there any best practices right now in the Caribbean, based on any data that UN Women has collected or anything at all that is showing, well, this is an approach we can possibly take. This is a good direction that we're heading in order to deal with and alleviate all of these challenges that we're experiencing, especially which have been exacerbated because of COVID-19.
Yeah, we do, and they're outlined in our summary report. We have to pull together just a summary report. It doesn't give that in-depth analysis yet, but it gives you some of the better practices as well as what the data is. And you can find that on our website, which is caribbean.unwomen.org. A lot of the countries, and I would say, a lot of our national gender machinery, LaFleur being a former head of one, but and a great resource in St. Vincent and the Grenadines, have continuously tried to make sure that all of the policies are as gender responsive as possible. I think we have to make sure that we have as much empathy for, yes, our governments are duty bearers. They have a duty to serve the Caribbean populations that have elected them. And we also have, as rights bearers, a duty to understand that there has to be that there has to be money to do this. If the tourism isn't coming in, where's the fiscal space for the countries to be able to deliver in the ways that we want them to? And this is where we need private sector. We need to hold private sector accountable. And we also need to be looking into more innovative ways in which we can get financing for gender equality. Because we can't only depend on tourism. Even when we have a more sustainable tourism in place, tourism product in place, we still need to be looking at other ways in which we can support ourselves, and our governments can do what they need to do to support us, but they need everyone on board. And so I think from what we've seen, civil society and governments are doing the best that they can with the tools that they have. We will continue to work to provide stronger, better tools and hopefully increased access to financing so that more people can benefit. The issue really, Tibia, is if you don't know, if you're not contributing, just a simple one, if you're not contributing to what some countries call their national insurance scheme, and the governments don't quite know exactly where you are or how to get to you, how will they, or you're unbanked, how are they going to get the cash to you? So many people in the Caribbean are not yet using digital means to access their banking. During COVID-19, you can't just have people going out to hand cash out. We also need to upskill ourselves in terms of, and it's easy to say because who can afford internet in some cases, right? That's a very hard thing. So we need to talk to our private sector organizations as well to figure out how we can create an enabling environment so that everyone can be reached and no one is left behind.
Thank you so much, Tawny. Indeed, we do have a lot to do within the Caribbean at all levels, regional, state-based, and community-based, to ensure that there is equitable access across the Caribbean so that people are able to live better lives within a crisis, because I always say within the region, we're always one error or one mistake or one crisis away from something happening that's tragic to us. And we've been seeing it. And coming right into what that looks like for the Caribbean, I want to turn right now to LaFleur, who is based in St. Vincent and the Grenadines. And when we're talking about, what does crisis look like in the region, we're not only experiencing COVID-19 pandemic, but then St. Vincent and the Grenadines was hit terribly by the active volcano. And so I want to ask you, LaFleur, the Caribbean is very vulnerable to natural disasters. We've seen it. We've seen the impacts of the global climate crisis, whether through hurricanes, flooding, as you said right now, that's happening in Guyana, where I am, etc., and as well as St. Vincent and the Grenadines with the volcano. And with the eruption, we've seen the devastation not only in St. Vincent and the Grenadines and those islands, but also we've seen it affecting other Caribbean countries as well, such as, for example, Barbados. Yeah. What have you seen within this climate crisis coupled with COVID-19 pandemic, how have you seen there have been increased gender inequality, and how has this impacted specifically the social and economic lives of women and men? Because we do know that once there is a crisis, people are affected, and we want to specifically talk about the gendered impact of that effect.
Okay, thank you, Tivia. And Tony would have provided the context as it relates to the gendered impact of COVID-19. And at this point, I would like to express my appreciation to CariMAN and the MenEngage for providing me with the opportunity to share my experience from here in St. Vincent and the Grenadines, and to be a part of the panel of experts across the region. And I would also like to make the plug here to express my appreciation to Tony Bradborough from UN Women. She is and continues to be an inspiration to me personally as a woman, as a leader within the UN entity, and also as an advocate for gender equality across the region. It's a pleasure to share the same space as we present here this morning. So from a national perspective here in St. Vincent and the Grenadines, like other countries across the world, we continue to battle the varied impacts of COVID-19 on our people, which includes the feminization of poverty and the unequal social roles and responsibilities that has a different impact on women and men, which further exacerbates the vulnerability of the poor and the marginalized. And added to the global pandemic that has claimed the lives of over 3.8 million persons worldwide, and which has spared no nation from infection, the mosquito-borne dengue fever outbreak is still causing, much discomfort here in St. Vincent and the Grenadines. And additionally, the Lasso volcano just wanted to be a part of history when it woke out of its dormant sleep in the latter part of December 2020. And eventually on April 9th, it exploded, sending over 20% of this country's population to becoming displaced and dispersed across the country. And with this explosive eruption, approximately 30 communities within the orange and red zones were evacuated to different shelters across the country that comprises primarily educational institutions, community centers, learning resource centers, and even religious institutions, churches. And from the 18,000 plus persons being displaced from this activity, we would have seen from the data collected that 79.2% of these persons preferred to be housed in private shelters, whereas 19.3% rather, or they went to public shelters, and 1.4% were accommodated in hotels through the Ministry of Tourism and Culture. And this accommodation provided for a safe space for vulnerable groups that included the elderly, the disabled, the pregnant and expecting mothers, and even mothers of very young children. That type of accommodation was provided for them. And this eruption unfortunately coincided with the COVID-19 pandemic and the worst dengue outbreak ever recorded, recently here in St. Vincent and the Grenadines. And we term it as a triple threat. It is real, and the effects can be seen in the decline of revenue and the destruction of agricultural and tourism products, the destruction of crops and farmlands that affected the livelihoods of alternative farmers in the mountain. And I know that I think it's a day or two after the explosive eruption, some reporters went into the furthest part of the yellow zone, and they did some interviews with persons who would have evacuated. And we had a couple of persons would have indicated that they were in the mountain, in the Lasso Mountains, when it exploded. Why? Because they went, although they would have been warned that there was some increased activity there. They wanted to go up there to secure their marijuana plants and so forth, to see if they can be able to harvest them, even if they're not fully grown and so forth, so that they can be able to have some money to spend, basically. And from the volcano also, we saw the destruction of tourism sites, the fall of Bel Air, or even the Trinity Falls, that affected the livelihoods of stakeholders, inclusive of tow and taxi operators, and even the local community vendors. From the pandemic and now the eruption, we see the multiple roles that women have to play. We see the disruption of the face-to-face learning, because at the time of the eruption, we were trying to see how best we can be able to recommence the face-to-face learning within the educational institutions, because I think it's from January, since we had this spike in the COVID-19, we had to close the schools in order to control the spread. So in April, plans were being made to recommence this face-to-face learning, so that the children, the students who are preparing for the external examinations, they would have that time to be able to, instructional time to be able to get as much education as they possibly can to write the examination. And with this face-to-face learning and the increased use of online platforms, it has added to the roles of women as teachers and even cyber police officers, trust me. And we see, or we know, that it would increase the potential for an increase in dropout rates, especially as it relates to boys. And we would have had conversations prior about male underachievement. So this is an added risk of youth crimes committed mostly by boys or males or male youths, and also teen pregnancies. And within the displaced population from the Lasso-Fail volcano, what the data would have shown is that more women sought shelter in private homes with family and friends, so as to avoid contracting the COVID-19 virus, and also to be with familiar faces. I mean, we haven't done an assessment in the private shelters to determine if there are other reasons why they prefer to be within private shelters than public shelters, but it is something that we have to think about as we move forward, because we still have persons in shelters because their usual place of residence is in the red zones, and we don't know as to right now how soon they would be able to return. What we also saw from data is that more males went to public shelters. And this may be an indication that hosts of private residents are more open to providing shelters to women with families. And furthermore, this is something that we may have to watch, but based on previous experience, as it relates to hurricanes and weather systems where persons would have to evacuate and go into shelters, we may find that as we attempt to resettle residents and return into some state of normalcy, men may tend to be the last to leave the public shelters. So this may be able to give some food for thought as we move forward as to the reasons why. Now, in this emergency context, women and men are affected differently, and it makes existing inequalities for women and girls, and even discrimination against the marginalized groups worse. In addition, during this time of crisis, women and girls may be at a higher risk of intimate partner violence and other forms of domestic violence. And this is even further compounded by the hurricane season that has commenced on June 1st, whereby heavy rainfalls can lead to landslides and flooding caused by lahars that, it can travel very quickly towards floodplains. It can have the potential to damage houses. It can be able to cover wide areas of low-lying agricultural lands, and it can be able to clog rivers and streams, causing large-scale flooding. So we must acknowledge that COVID-19 and natural disaster, they threaten to deepen pre-existing inequalities. And progress lost through these crises could take years to regain. Therefore, in addressing inequalities with some level of heightened significance and urgency, several development partners came to the aid of St. Vincent and the Grenadines, even right after the effusive eruption was declared on December 31st, 2020. I can recall that afternoon, immediately after the announcement, I got 2 calls. One was from Tony asking, firstly, how am I, basically, and then, what is it that we would need, because we have to think proactively, and then saying that, okay, if this is what you want, this is what we can be able to provide, and providing the necessary technical guidance as to how we can be able to fast track the support to St. Vincent Grenadines so that we can be ready for anything, basically. And we're extremely grateful to Tony and UN Women. Our second call was from UNFPA, Denise Blackstock. Same questions, because we continue to forge and build relationships with our development partners in order to strengthen our protection systems here in St. Vincent and Grenadines. And in addition to UN Women and UNFPA, UNICEF and PAHO and other stakeholders would have provided support to St. Vincent and the Grenadines in the form of dignity and hygiene kits, recreational kits, food hampers, and PPEs that takes into consideration the needs of women, children, and other vulnerable groups, especially in this time of crisis. And lastly, with technical support from UNFPA, the Gender Affairs Division, which is the national gender machinery here in St. Vincent and the Grenadines, we were able to design and conduct a gender-based violence safety audit in over 80 public shelters as emergency shelters up to 2 weeks post the April 9th eruption. And this audit was used to identify any GBV risk in shelters and to also generate data to be able to disclose the findings and develop recommendations around mainstreaming gender-based violence prevention and actions that can be taken in a coordinated manner. So I know I would have spoken a lot, food for thought. So I would end now, and I hope that I can be able to contribute as we continue. Thank you.
Thank you so much, LaFleur. That was a very informative and thorough presentation, really, on what is happening in St. Vincent and the Grenadines. It really just gives us a lot of thought in terms of understanding that, one issue is not just a singular problem, but everything is affected. And all, as a famous poet once said, all oppression is indeed connected. And so we've seen that as you presented. Of course, everyone on the chat, if you have questions for any of the speakers, LaFleur, we've heard Tawny before. If you have questions, please feel free to post them in the chat and we'll get to them after. I'd now like to invite Vidyrat Kissoon to comment now as well on this. Now, Vidyrat, statistically, we've seen Guyana has had high rates of domestic violence before the pandemic. And as Tawny's presentation highlighted, this has continued throughout COVID-19. And of course, with COVID-19, Guyana has also seen increase in terms of the loss of jobs, livelihood issues, added stress, the impact with varying degrees and levels of lockdown across the country. I'd like to ask you, how has COVID-19 increased the vulnerabilities for women, specifically in relation to gender-based violence?
Good morning, everyone. Good afternoon and good evening. So I will be sharing my screen during this, so please bear with me 1 minute. So thanks, Tivia, and in answering your question, I think I want to deal with 2 things. I look first of all at the context, because I think it's important to explore that context, which in which gender-based violence exists, and then talk a little bit about some of the work done within this first part of the conversation. But before I do that, I think it's important to bring into this space that, I'm speaking from Guyana and the Caribbean, and that these are lands which were taken from indigenous peoples, and that the violence, the work that we do against violence is also connected to that violence of colonization, and that continues all the time, everything that we do. I also, Tivia, would like to invoke in this space. I'm very grateful to be sharing this space with CariMAN and the MenEngage Ubuntu project. But I also like to invoke in this space the survivors of gender-based violence who've shared their stories, and the women who have taught me about gender equality. And I also want to hold in memory and hold space for the women whose lives were taken from them by men who were supposed to love them. So, in first of all, in looking at, I just wanted to, I think we've referred to the context for Guyana in COVID-19 from March 2020, when we had our first report. Guyana between March 2020 and August 2020 also had to deal with elections 2020. And that just further divided the country. So we had this very bizarre, crazy response where you were dealing with COVID and we're dealing with this uncertainty over whether Guyana would erupt into violence. And there was indeed pockets of violence post-elections. Currently, we also have this other national disaster, flooding, which has not been experienced before in Guyana. We're all regions. On top of all of this, we have this anxiety about our oil and gas wealth, and this national anxiety about whether this money will do any good for us or just make things worse for us in its struggle for who will have access to this money, and with all of the problems of bad governance, etc., which just forces the inequalities. Tani referred to the data around. I just thought I'd want to put in the space to the data around COVID specifically and gender. Our 2012 census, and here, and I'm using the words female and male because that's what the data records. 2012 census says that we had slightly more females than males. As the 10th of June 2021, the COVID cases are shared with me from the Chief Medical Officer Secretary at the Ministry of Health. There were slightly more females than males who were infected with COVID, but significantly more males than females have died as a result. The problem in Guyana is that no one knows this. We are not talking about this. We have not raised this as an issue from the beginning as to how can men better deal or take care of themselves so that they don't end up being in this statistic. And this is something we perceive across the Caribbean. So there's a deep silence around this issue of the men dying, right? Gender-based violence. Now, we understand gender-based violence, as Tani said. It's the intimate partner violence, domestic violence is the most prevalent form. But we understand gender-based violence in Ghana, and we need to talk a little bit more, as also being connected to patriarchy and to some of the systemic violence which is committed, which endures in the feminization of poverty, which we talked about. We talked about the unpaid care work, which was referenced in both LaFleur's and Tani's discussion, that burden of unpaid care work. We talked about the specific violence experienced by communities such as the LGBTQ plus communities, by migrant women in Ghana now has migrant populations from Venezuela and Cuba. And while there's been responses, for example, to the issues of migration from Cuba and from Venezuela, we have issues with how Guyana has been responding to migration from Haiti, for example. And all of that is complicated. So there are these intersections of race and politics, geopolitics, and how we deal with gender-based violence in Guyana. As was referenced, our Guyana Women's Health, Life and Experiences survey said 55% of women experience some form of violence, whilst 38% of women who'd ever had a male partner experienced physical and sexual violence. By the end of 2020, 18 men had killed the women and girls they were supposed to love. Between December 2020 to March 2021, there were 197 calls made to a national hotline for domestic violence. And I want to share Tiffany Ajeda's story in this space because I believe that it's important to bring the survivors, give space to survivors when we're talking, who can explain viscerally what, and this was a story shared in 10th of June 2021, um, last week, which just explains the dilemma. And it's not only about money. So just bear with me as I share this video.
I've put this out there, and the very people I've seen talked about, about abusive relationships in Guyana. People talk, but they don't walk the walk. I realize that. It's all for show. They say things like, oh, you gotta leave these abusive relationships, but it's never that easy. It's never that easy. And I'm sure millions of women can tell you that. And I've been receiving so many messages from women that's left Guyana, that's in Guyana, and who's currently, and the very people who are out there saying things like, oh my God, nobody dies. When a woman dies, you see all the activists come out, you see all the ministers and everybody want to be posting. But then now I put this out there, I still haven't heard from a minister themselves who claim to be talking about these things and talking against it. I haven't heard from any of them. I haven't heard from anybody from the police force. And people are offering support, and I admire that. But it's not just that. We have to, in Guyana, walk the walk, not just talk the talk. The system needs to change. I'm just looking on to see what's going to be done about my situation because I don't want to become another statistic. And the reason why I'm putting my evidence out there is if anything happens to me, then the world must know what was going on and what was going on with me, because he's not going to turn around and say, okay, I was an abuser. And then he's making all these reports. And then if he decides to kill me or do something to me, he can say self-defense. No, I had to do it.
As we hold Tiffany in this space, it's understanding that this complex point about how it's, there's a lot of money training, but there's no accountability in the systems, right? And Tiffany, as we hold Tiffany's story in this space, imagine that is being replicated where many survivors are left alone to deal with issues, even if there are measures in place, the systems are inconsistent and the police systems are inconsistent. Now, Bibi Ahmad is a survivor of intimate partner violence, and she's provided support and advocacy during the pandemic. And she shared with me that this worsening economic situation trapped many women in abusive situations, and that organizations like Red Thread and Help and Shelter so had raised this point before, right? There was also the issue of the limitations of being able to provide ongoing psychosocial and emotional support for survivors, because of course, when shelters and so the social distancing and other protocols, people did not have access to ICT at home for counseling. And there is a digital divide in Ghana. Ghana has the coastland, we have the hinterland, and internet access is just not available. Then there was this bizarre story about the police response, about where women went to make reports to the police station, but were told they couldn't come in because they were not wearing masks. Instead of the police offering the woman a mask, here, have a mask and then talk to us, right? And that is the madness that we deal with in our Caribbean. And then there's this constant power struggles where people who are responsible for care seem to only wait on the instructions. Maybe it's a legacy of our plantations where we have to wait. But some people have to, where ministers and police commanders, etc., have to give people instructions to act because we do not have accountability. I want to talk a little bit. Stephen mentioned the issue of alcohol. Now, in Guyana, of course, and globally we hear there's no correlation between the issues of alcohol and intimate partner violence and domestic violence. There's all this statistical work. But, Help and Shelter, which is an NGO in Ghana which deals with domestic violence, in October 2020, they wrote The consumption of alcohol reduces inhibitions, making those with abusive and violent tendencies more violent and uncontrollable, and as such contributes to intimate partner violence, sexual abuse of girl and boy children, and teens. So please note here that it's usually men's consumption of alcohol. So guess what though? For 2020, in a year which many of us considered bad, economics, etc., the two alcohol companies in Ghana, one had an increased profit of 11.7% and the other an increased profit of 15.7%. So so this context of what capitalism is about what's going on in our Caribbean, right? Where increased profits from the people who are selling alcohol in an economy which has less money to procure safety and goods and services. These things we need to talk about, and I see Stephen Thompson has raised that as as an issue. Um, NGOs initially reported, because of course in that March to August point, NGOs reported that they had difficulties. There were increased reports, so there were no figures to share data as Tani had shared in other places. Now with one of the things that has happened too is that we're seeing here in Guyana, which is not called COVID, that whilst we want to think about rebuilding, and these are questions coming back to rebuilding, that there are responses and people are trying to mobilize responses, of course, but we're seeing that in the discussions about responding to gender-based violence, we're seeing that there's a decreasing of importance of the principle of gender equality, right? So you constantly have these ideas that this is conflict resolution gone wrong and that men are abused too and men need help, implying as though that the men who are abusers are victims of the woman they are abusing. So we have all this complexity happening in this time where oil and gas is proliferating, and this resurgence of it's like reversing. We talked about how disasters seem to reverse some of the work done. So we now have to struggle now to rebuild, and we're talking about transformation. Normal, we cannot go back to normal because normal was a miserable time. So we have to look at opportunities to transform. So I'll end there and then I'll answer Camilla's questions. Back to you, Tivia. Thank you.
Thank you so much, Vidya. And indeed, we can't go back to normal because normal was not a great place to be in the first place. Thank you for that ending. And indeed, you gave us a lot, I believe, to contemplate and think about, especially in relation to the connections between alcohol consumption, for example, and gender-based violence in Guyana. And of course, the responses from the state agents and state sectors, which are very important, and hearing, of course, the young woman speak about her issue of gender-based violence. And I've also been following that story in the news. The reports that she has made and the lack of attention that she's gotten really is disturbing. Of course, we know that is just one in many, which is the most terrifying reality that we live in right now. I know it is 9:54 a.m., therefore Tani will be leaving us soon. Tani, I just want to say thank you for sharing with us. I don't know if you want to put on your camera and give us any final closing thoughts before you leave. And then, of course, we'll go on to Pauline after that.
Absolutely. I think there are a few things just quickly. If you go on to the Caribbean Women Count site, you will also see how alcohol and substance abuse are not necessarily causational factors, because that we can't really discuss at this stage causation, but we can say how they're correlated to the prevalence of violence in the 5 countries that have prevalence data in the Caribbean. We do have a lot of work to do with our cultural and creative industries to really look at the ways in which we glorify certain forms of masculinity, alcoholism being one. We act like alcoholism is cool. We have so many songs about it. But then when people go over the precipice, we're always like shocked. What happened to them? They just couldn't control themselves, even though we created an environment for people to go over the edge by numbing themselves and their challenges with unhealthy coping mechanisms. I also want to say there's something for all of you who love Chimamanda Adichie. I do. And she put something on her website today that I think is very important. Actually, sorry, right before I go to that, this particular circumstance that Vidya shared with us, I think, and Vidya, sorry, I should say Vidyata, rather than just go on.
Vidya's fine. Vidya's fine. Vidya's perfectly fine. It's
I
very
think
gender
we need
biased.
to start looking at accountability for our police system. And this is something we're working on through the Spotlight Initiative in Guyana. Social accountability mechanisms. How can you get promoted if you are not responding to these kinds of cases? What are the indicators of your performance? And how can we make sure that that is tied to your promotion, your professional development? Because if there's a woman who is being stalked and she is saying, how many times have we seen, not just in Guyana, across the Caribbean, people with protection orders being murdered? That means we need something else to do. Trinidad and Tobago has some very good legislation now around the digital monitoring of persons who have protection orders, but we need to start looking at what this means. What are the incentives for those who are the duty bearers in the essential services to deliver for women, men, girls, and boys who are experiencing this kind of violence? How can we make sure that a person who may be not a traditional gender identity does not get turned away from a police station when they've come with an assault claim? The same with a woman who doesn't have her shoulders covered. Like, we need to really ensure that we're focusing on what actual delivery of services within a human rights framework, which is enshrined in all of our constitutions, looks like. Now to Chimamanda. I think we as Caribbean people also have to think about, and I can even take myself away from this, but Caribbean people need to think about the way in which we look at punishment and justice. How do we look at accountability and justice? I am, of course, not saying that persons who perpetrate violence should be in any way not held accountable and dealt with in terms of the acts that they have committed. I also think we have to think, and this doesn't negate, this is the thing, right? We have to think about what creates these people. I don't think a woman in a relationship demanding her rights or arguing with you created your anger. There's something else that happened earlier on in your life. It's not her fault, right? Even if you are, someone slapped you and you kill them, that's your action. You're responsible for your action, right? And so we have to figure out, that probably wasn't the best analogy for all the lawyers out there who talk about, self-defense. If you hit them back, it's actually, you can get off in court for that because it's equal. But I do think we need to start thinking about, how do you maintain your action? The Partnership for Peace program, I see Shane Joseph online. Hi, Shane. Allows men to really sit down and think, how can I be responsible for my action? But I think also as a society, we need to be thinking about what happens before we start looking at this secondary prevention. How can we really get to the primary prevention where we are dealing with men and boys in a way where they can healthily address their emotional challenges? How can they cope in healthy ways? And it's not mother's fault. We can't say, oh, the mothers raised them poorly. We're always looking for one person to blame. No, this is a community. Villages raise children. We have raised people to think that violence makes sense. And I think one of the things that Chimamanda wrote today, you should go to her website. She wrote something called It's Obscene, and it actually really resonated with me on many levels, because I feel that even in our most, where we plan and hope to do the best, we can become puritanical. And when we are talking about issues that are confusing, because many of us have grown up in this, we don't allow for people to explain or to explain to people why their confusion, or get them through their confusion, right? And I think there needs to be space for that. I'm not saying that we excuse certain things or we don't hold people accountable. We need to be able to have a conversation in a way that is empathetic and enabling of the environments we want in our Caribbean, which are peaceful and just society and safe society. And there's more to do. Yes, we need to work with the police. Yes, we need to work with the services. But even before there, why does this man think he can stop this woman? What in our society, what in our ideology has made him think that he has the right to do this? And these are things we need to be working on as well. Those social norms are critical for our ability to really build back equal from COVID-19. Sorry to leave. This is a great conversation. I really wanted to hear the other colleagues as well. It was great to hear LaFleur. Always great work you're doing. And I think the one thing is we have to make sure people like LaFleur and Vidya and everybody else who are doing the work have that support. Just how are you? Because this hard work, especially when you see the cases coming in all the time, just how are you and how can you give them support?
Thank you so much, Tani, and we really do appreciate the time that you took to join us today. And a lot of the information that you shared really about accountability, community accountability, individual accountability, as well as state accountability is so critical for this time. And one of the things that I think about in my own work is about what are the gendered ideologies that dictate the society that we live in today. Why it is man is head, woman is underneath, and then from that we hear that, okay, well, these gender norms dictate that women are to do X, Y, and Z and men are to do the other, and if you come out from that, then you are rebellious or a threat to masculinity, unfortunately, and the end result is violence. And really and truly, as I believe all of this work is pointing to, and we're going to hear from Pauline next, all of this work is pointing to one critical component by Tani, thank you. All of this work is pointing to a very critical component. We need to think about ways to reconstruct and even deconstruct and dismantle the gendered ideologies that we exist within today. And it starts not just with the state, it starts within our communities, or the ways that we raise our children. From the moment we find out someone is pregnant and we decide to have a gender reveal, and there are causes and consequences to that, right? And all of these things impact us to this day. So let's go straight into Pauline is going to talk to us about sexual and reproductive health rights from the Jamaican, hopefully Caribbean perspective. But specifically, Pauline, and welcome. There has been a significant impact, just like in all the other areas, in relation to sexual and reproductive health rights for women and girls within the Caribbean. We've seen these in marginalized groups with people with disabilities, LGBTQI plus people, etc. What can you tell us since the pandemic? What can you tell us about the impact of sexual and reproductive health rights in terms of it being accessible within the Caribbean? And especially love to hear about the context from where you sit in Jamaica.
Okay, thank you very much, Tivia. Welcome and greetings from Jamaica. Thanks to CariMAN and MenEngage for really including me in this wonderful panel. And so I hope I can do it justice. I want to provide some context before we get into sort of the impact of COVID, just so we understand what we're talking about. We talk about SRHR, sexual and reproductive health and rights. So let's break it down. Reproductive health involves reproductive health, adolescent health, maternal health, contraception, sexually transmitted infections, abortion, female genital mutilation, and child forced marriage. These last two we tend not to have in the Caribbean to the extent that it may exist in other cultures. So sexual and reproductive health would include services that improve the antenatal, perinatal, postpartum, and newborn care, providing services of high quality for family planning, including fertility service, combating sexually transmitted infections, including HIV, other reproductive tract infections, and cervical cancer and other gynecological morbidities. Okay, so the objective of reproductive health services is really to make quality maternal and reproductive health services accessible to people. But there are some serious gender issues involved here. When we address sexual and reproductive health issues, we are in the main addressing women. Unfortunately, women are the childbearers and have the burden of pregnancy prevention. It ought not to be so, but it is in our societies in the Caribbean. Only 2 of the 8 modern contraceptive methods are designed for use by men. That's the male condom and vasectomy, and we know how unpopular the vasectomy is. Access to sexual and reproductive health services. In the Caribbean, SRH services are provided either by government or by NGO providers or by both. In Jamaica, we have the government providers and we have the Jamaica Family Planning Association, of which I am the CEO. We operate 2 facilities, one in Kingston, the urban center, and one on the North Coast in St. Anne. And so across the rest of the region, access to SRH services is primarily from clinics, static clinics, mobile clinics in some countries, and pop-up clinics. These are clinics that we pop up as required. So all new users of family planning methods and most SRH services must be counseled and screened. And once they have made the decision to use a method, let us say the oral contraceptive or condoms, they can access resupplies via the clinic or through mobile services or community distributors. Users of other methods must come into the clinic. So what impact has COVID-19 had on services, SRH and R services in the Caribbean? Now in March, mid to late March, most of our countries locked down. And one of the things that happened is that we limited physical access to clinics. Some clinics were able to open and continue to serve the client with modified but limited hours. In Suriname right now, they are on lockdown between May 31 and June 18, and they have permission only to operate for a few hours on 2 days each week. So we can see some of the issues around that. Some clinics have had to close. In Trinidad and Tobago, under their new measures, and those measures were introduced more recently, the Family Planning Association there was not initially classified as an essential service and was forced to temporarily close its static clinics for the entire month of May. But TNT is not the only country where family planning clinics were not considered providing essential services. Many of the FPA clinics had to get recognition from the government as an essential service, and we can see what effect that would have in terms of delaying operations. Our first speaker, Tony, talked about the effect of the lockdown on job loss and the extent to which it affected women more than men. The ILO has estimated that between March and September last year, 34 million jobs were lost in the Latin America Caribbean region. Women more affected than men and youth more affected than adults. The effect of that we know is on reduced income. During the first 3 quarters of this year, work hours dropped by almost 21% across the region, while labor income declined by about 20%. I mentioned that because some of the providers of family planning services, like we do, we charge for service. We have to, we are not government supported. We have to find our own way, so we charge for services, SRH services. COVID resulted in or contributed to closed borders. Many of our airports and shipping ports were closed. And that contributed to shortages in contraceptives because shipping was affected. And what effect did that have? We don't have the data right now, but we anticipate an increase in the number of pregnancies in the near future. In one case across the Caribbean, there was a miscarriage because there was a shortage of contraceptives. The closed borders also affected the availability of protective equipment, PPE, so that our providers couldn't be protected. In those clinics that were operating, could not be protected for a while. The COVID-19 has had other effects on service delivery across the region. In some public health facilities, SRH providers were shifted from doing SRH work to strengthening the emergency response. So we had fewer providers who were able to provide SRH services, therefore the SRH services could not be provided. We have heard about the effect on intimate partner violence and gender-based violence. So I won't go into that. Tony mentioned quite a bit of that, but in Barbados, just to say that the first 2 quarters of 2020, Barbados saw an increase of about 30% in reported incidents of domestic violence, many of which were intimate partner violence. Now, one of the issues we deal with is not just the service delivery, but the rights issue. Each individual has a right to decide when, how many children they would have. Each individual has the right to quality service and to access service. COVID has really impinged on many of those rights. But I must say, the effects of COVID have not all been negative in the area of SRH. COVID has galvanized us to adopt new ways of reaching and serving clients. So you will find that many providers are now providing telecounseling, telemedicine, mobile service delivery, etc. So it has galvanized us to think differently. In an interesting way, it has also increased clients for the non-government providers. We here in Jamaica have noticed that an increase in the number of clients who have come to us since June. And one of the reasons they give is that they don't want to be in the crowded setting of the free service of the Ministry of Health. So they would rather come to us and pay the fee that we ask them to pay, but they're not in a crowded situation. The third positive effect, and this is something I want to put on record across the region, COVID has highlighted the commitment of our service providers. Service providers did not have the luxury of working from home. They had to be out every day, even when there were spikes in some of the countries. So I really want to thank them for their commitment to serving us throughout this pandemic. Thank you very much, Divya.
Thank you so much, Pauline. Very informative in terms of giving us an overview of SRHR within the Caribbean since COVID-19. I'm now going to open up the chat really for questions and comments. I see a comment here from Stephen for you, Pauline. It's about sexual education in the Caribbean. He notes that it needs to be revamped, strengthened, and better accessible in general. He says that we also need to eliminate the prioritizing of scare tactics as a primary method, along with abstinence in sex education. It's more of a comment. I don't know if you have a response that you want to offer to that comment.
What I would really agree with the comment on the scare tactics, because we tend to talk about pregnancy prevention in terms that, okay, the negative aspects of delaying first sex with young people. And there are some positive things in delaying, and we tend not to talk about those. So I agree with that viewer. On the matter of the education in schools, that needs to be strengthened significantly. There is a fear that if we provide sexuality education to our young people, they will become sexually active. And we have seen from the research that that is not so. In fact, what happens is when young people are not appropriately informed about their sexual activity, about prevention, about how their bodies function, they experiment and they get into trouble for which they are not prepared. So we would rather provide them with the quality information and education so that they can protect themselves when they make the decision to become sexually active.
That makes a whole lot of sense, and sometimes I just wonder what the limitations are around implementing these strategies, because a lot of the activists, scholars, etc., are quite aware of what should happen, but yet when it comes to its implementation, there are always challenges and there are always some issues. I see LaFleur has her hand up. You could go ahead.
Yeah, you asked the question as to the challenges, and we see in St. Vincent and Grenadines as it relates to the culture. the culture of the society. We know that we are having sex, but we don't want to talk about it. I know from the standpoint of Gender Affairs Division, we have a program whereby we assist adolescent girls who would have become pregnant in school so that they can, access the opportunity and re-enter, right? But we don't always want to be reactive, because if we want to control the numbers as it relates to teenage pregnancy, then we can be able to add towards reducing poverty and so forth. We have to look at it proactively. So we would want to use the data, the prevalent data as it relates to teenage pregnancy, whether it be by community or by schools, because there are some schools that report high numbers of teen pregnancies. So therefore, there needs to be some level of intervention to prevent. So maybe we would say we would try to strengthen their health and family life education program, because maybe they need some support in that area. And we would reach out to the schools, but then they want to know what questions are we going to ask, what our presentations are going to look like. And they would want to censor, oh, don't speak about this, don't talk about condoms, don't talk about sex. So what are you going to talk about? We know that they're having sex. So one strategy we use, because the age of consent to have sex is 15, we would target from Form 3 up. So it will try to alleviate some of the fears. But as Dr. Russell Brown said something, and I know she's saying that that's going to put further fear in person's head when you say sexuality versus sexual. Because when you say sexuality, now they're going to start thinking, oh, we're going to encourage the LGBT agenda in the schools and so forth. You understand me? So there are a whole lot of dynamics that prevents us from providing the necessary information for informed consent to children.
Thank you so much, LaFleur. And I see Vidya. Vidya, I don't know if you want to unmute and contribute. I see you put something in the chat.
Sorry, I have this bad habit of when people are talking about looking for links and things that they're talking about. I think I remember in Ghana when we were talking about age-appropriate family life education, but I just realized that I believe the family planning, Dr. Pauline, I think there's a curriculum or textbook I think FPAJ had done, which was very progressive. I remember it had received objections in Jamaica for some components. But I think in Guyana, I know when GRPA and so we're talking about it, this was the model they wanted to use. I think CariCOM was supposed to be piloting this, which was to open it, and I just found this resource because this has come up before about people asking. We were in another conversation where a Bahamian woman was she's trying to redesign a curriculum for the Bahamas as well because she thought the Caribbean didn't have any. So I think sometimes, the work is done, like these curriculums, but there's a problem with implementation, there are resources available and excellent work done. I think, as I said, I remember seeing that curriculum from FPAJ, which I thought was mind-blowing, and hoping that, but in Guyana as well, the teachers, and there's a whole madness. I remember our education systems are about respecting the plantation and so on. It's not about liberation, how, right? So, yeah.
I see a question in the chat for Stephen. I'm not sure who Stephen is directing it to, but I'm going to ask actually all three. I'm going to expand the question, right? So Stephen asks, and Stephen will permit me to, just change the question a little bit. But really, truly, what are the thoughts on how to address the issue? Well, Stephen says church, but I'm going to say religion, right? So how do we address the issue of religion in the role of sex and sexuality education and interventions? And I would say not only for youth, but for women and men as well. And beyond just sex and sexuality, but also when we think about gender-based violence, for example, right? A lot of these issues are tied, and a lot of the decisions that people make within these issues are tied to religion and societal norms. And so LaFleur, I don't know if you want to start, and then we could go to Vidya, and then we could ask Dr. Russell Brown to wrap up that question, because I know, she is the expert in that area. But do share, LaFleur, you could begin. Like, how do we deal with the issue of religion within the Caribbean? and the issues of gender and gender-based violence and sexuality?
Okay, well, so from St. Vincent's standpoint, I can only speak from, but we deem ourselves to be a Christian society. I mean, I think sometimes it's convenient on certain issues, and they have a lot of influence as it relates to changing the norms and cultures within St. Vincent Grenadines. And the whole aspect of sex and sexuality is a tough nut to crack, especially with the Christian society, the Christian institutions, basically. It's not an easy fix. I can be able to bring into context an example that our ministry is spearheading the reform of the sexual offense legislation in St. Vincent Grenadines and trying to see how best we can be able to make it human rights compliant. And the opportunity was ripe 2 years ago because of the number of cases of sexual violence against children and the fact that, you know, the access to justice, or you're seeing justice being served, was few and far. And there was a public outcry. So we got support from an international organization to see how we can be able to modernize our laws. We're trying to see how we can be able to remove the sexual offense provision from within the criminal code and having a standalone legislation that can be able to provide consistency in the application by all stakeholders, inclusive of the police, and to ensure that the public can have access to it and can understand it. So there were different perimeters to it. We have the offenses part, we have the vulnerable groups part, but when it came to just one part, where's the buggery part, like that just put everything on a standstill. No matter how much you try to indicate to them that we do have an LGBT community here. You understand me? So what provisions are we going to put in place to ensure it's not as though that this community or this group is so special that we have to make it, you know, all the necessary provision for them have access to protection and justice in St. Vincent Grenadines based on our discriminatory practice, basically. That was a standstill. 2 years now, no. They would rather throw out the baby with the bathwater than to touch that, right? When we had our 16 Days of Activism campaign, we normally target religious organizations. And we went and we had a session within the church service. And it was basically, it was like a panel discussion. And we had some questions on the floor as it relates to the autonomy of a woman. In terms of she being the property of a man, and if it's unfair that a husband cannot be able to have sex with his wife. And I would say this in conclusion, tackling sex and sexuality within the religious institution, it's not going to be an easy or quick fix, but it can be done. You just have to find the right person who can be able to speak for you. But this person has to be engaged throughout the whole process. They have to be sensitized education so that they can be able to share the message in whatever format that their peers can be able to understand.
Thank you so much, LaFleur. That's some good examples from St. Vincent. Video, what can you share with us any thoughts or examples you have from Guyana, especially around gender-based violence and religion?
So certainly, thanks, Sylvia. So one of the things, Tanya mentioned something very interesting about how we must listen, and I just went to check what Adichie had to say about this thing about listening, and I'll tell you all something. I mean, there's a space and time for listening to stupidness, what we call stupidness. I don't know if everybody understands what stupidness means. And there's a space and time for challenging stupidness. And this is 2021. The women's movement in the Caribbean has been in existence for time immemorial. I refuse to listen to stupidness still, that women must subject themselves. I must respect the opinion of people who say that submission of a woman to her husband, that Ephesians must be partly quoted and used and all of that. No, no, no. I don't have to respect those views. I don't, right? I have to respect the individual, and that's the different thing. I think we have to understand the difference between respecting and honoring the humanity of the individual, and understanding when those individuals are locked in dangerous belief systems which cause harm to them and to others, right? So we need to unpack this in the Caribbean about understanding where respect and humanity. One of the interesting things though is that I have been grateful, and when I talk about is understanding too how women especially have negotiated these spaces to talk about sex and sexuality, and honoring and respecting that. And I say that everyone, because in Ghana, which is multi-religious, multi-faith, people have found, whether they're Hindu women, Muslim women, Christian women in the different denominations. One of my mentors, Beverly Brapichan, was very prominent in the Seventh-day Adventist community, and it was a struggle for her. But it was with the Seventh-day when I was a very young person. My first workshop I think I did with faith-based leaders was within the Seventh-day Adventist community. So there's all these different nuances and ways of engaging that we have to be open. Yes, I agree with that, but we do not have to accept with these beliefs like that. The second thing is when the state has to provide values, and there's going to be these wars, and they're being fueled by America. White evangelical America continues to enslave us, right? And that continues. And I mean, now that Donald Trump has left, so there's all this geopolitics around, especially some of these crazy views, which we have to challenge, right? But the thing is how much energy, is how do we manage our energy? Is that there's an engagement, because I have shared this before when people saying that I'm grateful that within where I thought and I expected that there was objections, is that in listening is understanding clarity. So when we had a domestic violence conversation a couple of weeks ago on faith and domestic violence. It was intense, and people cried, women cried, and the faith, because of the way the faith community did not support survivors of domestic violence, and women. The woman talked about that, and I share a link to the write-up we did. But it is for us to enable and facilitate those conversations, to understand the complexities that a woman leaving an abusive relationship should not have to feel that she has to disband her relationship with God and her community. And it is for the faith communities to also enable. And I think there's a gradual learning about this, and we're seeing that in terms of the complexities of sex and sexuality in Ghana. We see that there are diverse religious views, and that is what you hold on to. That yes, I mean, in Trinidad there are diverse religious views, right? So we hold on to the diversity in religious views and understand that there are issues of rights and health, and also being open to not to understanding which views influence what. And of course, I also know that there's a problem with language and how we use certain words and so on, like LaFleur, I think, and Pauline said, you bring up sexuality, like I said, all this gay sex and all of that. No, and unpacking that and unpacking myths around what all these things are, it requires a great deal of, I think, sometimes there's a great deal of patience and so required. But at the same time, we have to maintain values and ascribe and reinforce principles and be very careful about how when we might be seeing to succumbing and some, all of these discussions. So one of our faith-based leaders in Ghana, Pat Shirtan Bisnath, she was involved in a project which unpacked the biblical, looking at the stories of Esther and so on, and there was a document from looking at the biblical view. So there's also this facilitation of encouraging people to check in the scriptures. Certainly within the Hindus, we have this issue of Navratri, and we have been using the worship of the Mother God. you can't be worshiping, there are memes shared during Navratri that you can't be worshiping the mother goddess while you're beating up your wife and abusing women around you. So it's all these things that we have to, it's all part of the work. So I mean, I just randomly shared
Yeah.
that. Yeah.
Thank you so much. We have like about 25 minutes or so left. Dr. Russell Brown, I want to invite you to comment as well. How do you see the impact of religion happening on our society right now in terms of, with women and SRHR particularly? How does it impact the work?
Loeffler mentioned and touched on several of the issues. There is resistance, there's no doubt about it, depending on the topic. None of us on this panel is old enough to remember when there was resistance to contraceptive methods, the oral contraceptive and injection. The church objected to that. There's still objection in the Roman Catholic Church to many of the methods. Abortion is not a topic that any of church members want to talk about, nor sexual activity outside of marriage. However, there are ways of I think getting the church involved and engaged. Now, the church is not a monolith, okay? We have various denominations within the church, so to say. In my own experience with church, we worked with youth ministers and trained them, exposed them so that they could do the work with their youth within their church. And we talked about sex, and we talked about it from a biblical point of view, okay? So that in fact, they were more comfortable in talking with the youth membership of their church around sexual issues, respect for women, men respecting women, women respecting men. How do we treat each other? Relationships. What do we expect out of relationships? What demands do we make on each other when we get into relationships? And it was amazing to see the effect that exposure of that exposure on the youth ministers themselves. And that program is continuing in the churches that we worked with. It was a small group of youth ministers from 8 denominations, okay? And they continue, and they're doing training of trainers within their churches around sexual health issues, focusing on youth responsibility, rights, yes, but the rights of the other person as well, not just my rights. What is the other person's right? So we deal with rape, so that's an issue. When an individual does not consent to have sexual activity, that is rape. We talk about the legal issues, age of consent, plus some other things. And so I think it is possible, depending on how you approach it, to work in small groups of churches rather than consider the church as a whole. We will never, I think, get to the place where the church as a whole buys into many of these conversations. So that is my input here. Let us think of ways in which we can, in fact, make a difference with a small group of people, and in fact, that small group of people may be able to influence the hierarchy within the church.
That actually ties us into the second to last question that I have. And I would ask you to begin, Dr. Russell Brown, with responding. From your organization's point of view in Jamaica, what are the response measures that you think need to be included at national or community levels or the regional levels to ensure that there's proper assessment of the impact of COVID-19 in the Caribbean, specifically around SRHR?
Okay, at national level, SRH, first of all, needs to be considered an essential service and to be included in all disaster response initiatives. The second thing I want to say, and this was mentioned by Tony, we need robust data collection and management systems for every one of our civil society organizations or the public sector providers. So systems that will enable disaggregation of data by gender, by geography, etc. And we need coordination of those data systems. The Spotlight Initiative here in Jamaica is attempting to do that, at least among the civil society organizations, trying to get the organizations to have a common set of data that they all collect, which will enable us to make plans and projections around sexual and reproductive health. At the community level, we need to, I believe, engage with community leaders so that they, in fact, understand the value of data and data collection and can be engaged in that process. But they also need some education around SRH issues if they're going to be useful to the service. The issue of child trafficking has not been mentioned in our discussion so far. But that is an issue which I think at community level, communities can be trained. And I think there's a project ongoing right now in Jamaica to train peer educators at community level to identify issues of child trafficking, oftentimes which leads to sexual abuse of those young people. So that's the contribution I'd make to that question, Sylvia.
Thank you so much. The floor, do you want to add, what systems and measures, response measures should be put in place at a national, regional, or community levels, to support or to address the assessment of the impact of COVID-19 on gender in the Caribbean?
Okay, just to crystallize what Dr. Russell would have indicated, for me, I think that there needs to be some integration of gender and child considerations into the response protocols and measures, basically. With that also being said, and especially in light of what's happening here in St. Vincent and the Grenadines, we need to think of establishing protection working groups because, sometimes we may think nationally that COVID-19 is just a health crisis. It just affects the health sector, but it affects everybody, all sectors and so forth. And we need to ensure that there is some task force or group that is looking after the well-being of the citizens and men, women, boys, girls, and so forth. And thirdly, I would say that there needs to be more targeted sensitization messages so that persons can be informed as to particulars as it relates to COVID-19 and so on. Because interestingly, when Tony mentioned about the data as it relates to the mortality rates worldwide, that more men would have died from COVID-19, then that draws is something that indicates that some sensitization messages need to be out there too, that is geared towards men so that they can be able to take the COVID-19 more seriously.
Thank you, LaFleur. Video.
Hi. Sorry, just a little disconnect in the area. I think the points that we've made in the Caribbean is that we need to keep having the Caribbean conversation because, of course, we're moving multiple disasters too, right? So it's like flooding, hurricane, volcano. We cannot go back to normal. And I wish we can talk about transformation and not go back to normal. We can't, but we will. And this is the problem. Everyone is going back to normal. So all the opportunities for innovation, which I think we've learned, and we synthesized Dr. Russell Brown talked about things that we never knew that we could do, that we could provide telemedicine. We had people lining up for places and having to spend money to travel long distances when they didn't have to, So all of these things all of that now we can put into practice and help with communication. And there's need to look at the digital agenda and look at how digital technology can help because it's very critical in a disaster. We've always talked about this. We certainly need to talk about, as LaFleur mentioned, the men's access to health and well-being, mental health and well-being, and that has to continue. And this discussion about alcohol consumption as a Caribbean thing, and drug consumption as correlation with violence and our ill health. That has to be more prominent, because I'm surprised. I didn't know. I mean, Tani said it. I just checked the website, but we didn't know that that data exists, because, of course, there's a very strong alcohol private sector in the Caribbean, right? Thanks for sharing that, Camille. Now, in Guyana, for example, we have to look at the intersections. Now, we, for example, have a national COVID task force, which does not have any representatives from women's groups on the task force. And in Guyana, and I think even for us, is that they're different places. So what happens on the coastline does not happen in the hinterland, what happens within certain communities. So sometimes we have to have participatory ways of designing the responses. You can't have top-down approaches, which is what has been happening. We have to talk back about gender equality, and all of this, and not only have this tokenistic representative. I don't know what our political situations are across the Caribbean, but in Ghana, we're very deeply divided politically. So anything that is done under one administration is undone by the next, and it's stupid. And the funding agencies have to keep repeating. So all this knowledge that we build up, the floor working on this for years and years, somebody else comes and says, no, they want to start over again. So you keep going back rather than continuing with learning. And certainly there are lessons of resilience which are shared. And I say this because I think of one friend who said that the pandemic was good to her. She made her decision to leave. And Bibi Ahmad, she said, many people said that this opportunity of crisis said, that they realized that this is a time to find joy or find wellness in this madness, and to find ways of leaving abusive relationships or trying to deal with their abusive relationships. And that is complex, as we know. The other thing I wish we could talk a little bit more, and I know there are a couple of psychologists on the discussion, and Tani talked about that, but also community, whether we do it from spirituality or so. This is a lesson I've been learning the last year, is how do we talk about healing after all of these traumas? What does community healing look like? What happens when you go back, or when the floodwaters go? We bounce back. I think Tani said her uncle said, yeah, we come through. But I don't think that, I don't think we even, we go from one crisis to the next. We go from, and we don't ever really reflect, heal in communal ways. And that is something that I wish we could look at, healing from these different disasters and so on. And I wish there were ways that we find resources. And just a final point is that I want to make is Tani mentioned something about how we have to finance gender equality. I found that in Guyana, certainly, and I believe in the Caribbean, we've had a lot of money to deal with gender equality. What is needed is strong political will. But we do not have political will and accountability. We have leaders in our communities, the Florine calling no names, who have been accused of gender-based violence and sexual violence. But our populations continue to elect them and hold them as honorable. And we can't do nothing about it because this thing named democracy puts up these people who don't really care about gender and gender equality are not accountable for that. Pauline, we know the cases in Jamaica, right? We're watching carefully what's going to happen to those MPs. The video out there, but nobody, more people concerned about it, but so this is the craziness that we're dealing with, and that we're going. I mean, if that wasn't a disaster already, I don't know what is, So yeah, over to you, Tivia.
Thank you, Vidya. And you did raise some personal examples there, specifically around healing, which unless I see any question in the chat for anyone else, and we have 10 minutes left, really, because I hand over the last 5 minutes back to Makesi. So before I do that, hand it over, and there being no other questions in the chat, I then would ask now my final question to the three presenters. And this is a personal question just as much as it is a question about your organization. But personally, and feel free after to give your closing remarks as well as we wrap up today's session. How do you think personally you can work towards a resilient, as the language of video used, a resilient and an inclusive recovery from COVID-19, the Caribbean? So I could begin with Dr. Russell Brown. So how do you think personally, and even your organization, you can work towards a resilient and inclusive recovery from COVID-19?
That word inclusive is bothering me. I think I understand what you mean, but it can be interpreted in so many ways. We are a small NGO, but we have a saying in Jamaica, we little but we talawa, meaning we can do big things. One of the ways that I see us doing that is within our own facilities to ensure that our providers and clients are taken care of and are managing in the best way possible. And this means not just the sexual and reproductive health issues, but in the conversation with them, what are the other issues? What are their other needs? And to make referral to other places that we know about, and to keep following them up, because it's one thing to just refer and leave it there, but then what happens? Did the person go? Having gone, did they get the care they wanted? And if not, what did they do? So I think that is a very important part of what needs to happen. We are engaged in various working groups, government sector working groups. And in those environments, in those contexts, we make a contribution as required. And sometimes we're quite outspoken around issues. And so on the matter of ensuring that SRH services are considered essential services, it's not an issue in Jamaica, but I can see that we need to become advocates that is part of our emergency package, because we're going to continue to have emergencies, whether it's hurricanes, hopefully not volcanoes, flooding, that we are prone to all of these things, and they may get worse given the climate change situation. And so, in fact, we will become advocates around how do we, in fact, ensure that SRH are, especially the rights, because people have rights around sexual and reproductive health issues. All people, LGBTQI, men, women, young people, adolescents. So we become advocates, not just in those environments, but to ensure that the policy environment is also changed and reflects these changes that we are advocating. We are going through a period where abortion is a hot issue here. And we have a member of parliament who has been quite outspoken on the matter. But it seems that we have hit a spot that, we can't move from that spot, because abortion is a very, very unpopular topic. And this is where we have not just the church, but other individuals speaking out against it, because it's considered to be murder. Okay, and so we don't have what Guyana has and Barbados has. Barbados and Guyana have the facility for a woman, if she chooses, to get help before the fetus gets to a stage where it becomes viable. So those are areas we see us working with partners to ensure that the policy environment is addressed and changed.
Thank you so much, Dr. Russell Brown. We really do appreciate your contributions today. LaFleur?
Okay, from a personal perspective, I continue to use my voice to advocate for gender equality. I think it's loud enough. And interestingly, when I was informed that I was, going to be appointed in this administrative role, I was like, I don't want to be ungrateful, but I'm a technical person. It's taken me away from the front line of advocating. But then, I thought about it and I sought the advice from different persons. And they say, you have to look at it, a blessing in disguise that you are at a top management level where you can be able to guide the policies towards gender equality and so forth. And interestingly, even though I've been in administration, I'm still being called to give presentations just like today and so forth. And I'm extremely grateful. And what I did also was to join a civil society organization that's towards the advancement of women. So I can be able to add there as well. But from an institutional standpoint, countrywide and even regional, we would have seen through the investment by our partners, our development partners, whereby they would have helped us to develop policies and national action plan and what's not. We need to take things from policies to action. We need to take off all these policies off the shelf that's gathering dust and implement them. You understand me? We need to be able to have these things as priorities. So whenever anybody comes to us, we say, this is what we want. We keep telling them this is what we want, and we get the resources to implement them. It's all good and well whereby we can say, yes, we have a domestic violence legislation. Yes, we have a gender-based violence reform pathway, but if they're not used, what good are they? So that's just my 2 cents.
And we really do appreciate that 2 cents. LaFleur, thank you so much. And so I'm gonna Camille just commented, well, Dr. Cummins just commented, thanks LaFleur for sharing. We really do appreciate it. Vidirat, you are last to speak and close us off today.
So I'm going to stumble. So I just want to, I'm very grateful to share this space. It's been a long time since I've been in a regional space like this. So just to say that I'm not a part of any organization in Guyana, and that means, humanity is the organization I'm part of.
But if I can interject with you, you are not a part of an organization, but you do amazing work in Guyana as an activist, and therefore your contribution is very important and valid.
So
Go ahead.
Tivia, thank you very much. And I will say, so one of the first things that I think as an individual, I turned 50 last year. This is very personal. So therefore, I'm caught in this midway. A 50-year-old man all of a sudden, having done this work for half my life, and the energies and emotions in it. And realizing that, first of all, that they're young people. So I'm actually hoping that people like Tivia and Sowote will continue and sustain, and I try to find a way in which I can facilitate the work of people like Tivia and so, as using my privilege as a middle class, cisgender, 50-year-old middle-aged man with a host of back pain and so on, right? So that is the first thing. Where is my privilege? The second thing is this continuous learning and finding innovative ways, like how we use this technology and so on. Like I just shared it. Like one of the things has been the DV conversations. When when Polly, this thing with the muting and unmuting, I've never been more conscious of how often people can be muted, even within our own spaces. When we try to talk about inclusivity, how we mute people. And therefore I'm very mindful and trying to be mindful of how to make sure I use my privilege to unmute and to mute myself. And there's a deliberate thing I do about muting my mic sometimes, right? And I think that's something that we have to, this is part of the transformation. Ghana is in this very strange place because of the awful elections we came through. All of a sudden, we're back into this very ugly political space where we're going to have massive reversal of all the rights and all of the things that are happening. And you interject oil and gas into that, right? So the concern now is no longer, if we didn't have oil and gas, we would have had to depend on each other for survival. But now it's oil and gas out in the ocean. And therefore, all of us have to try to get our heads. So environmental justice now is now intersected with all of this. And I know in our conversation here today, we didn't talk so much about the links between environmental justice and gender justice. But that is something that in Ghana, Maylene honoring people like Esther Figueroa from Jamaica and Maylene from the, who are trying to bring attention to this, because it's all, you said all oppressions are interconnected, we're learning it. So that's where we are. Like I said, I know that we're going back to normal, but I'm trying to see, in my head, I'm trying to pretend that I'm moving forward to a different normal, even if it is for me personally. But a normal that can be nurturing and definitely for the sharing, there are things that are being done. You said there's all these policies and so we had the abortion legislation, but guess what? It was 25 years later before the abortions were really available in the public hospitals. And that is true. Tivia knows about all of that, right? But that is true. all that work that had to be done. In fact, we're now having this discussion about, was there a failure that after passing the legislation, the abortions still were not available to poor women, even though we have a public health system? You know what I mean? So all of these things that happen, you can have all the policies, sign the rights and everything, but on the ground. And it's ways of having these conversations and keep pushing and advocating. And looking at the global world, I mean, when the Americans elected Donald Trump, sexist, misogynist man, what did that mean for the rest of us who were doing this work? Right? And democracy triumphs and party loyalties. There's a whole set of craziness that we have to unpack here, while dealing with back pain and all the things that 50-year-old men have to deal with, all the trauma, gray hair and all these things. So, right. Thank you. And I'm very grateful to CariMAN and this space and to all of you. Thank you.
Thank you so much, Vidyarath. And even just to add at the end of that, as we talk about Donald Trump, we also don't talk about what the cost of the current president will do with continued closed borders and threats of what happens in global south. People go to the US. It continues. And of course, imperialist policies that affect the global south. I could go on and on about this, but our time is up. So thank you, everyone, for coming. At one point, we had 37 people in the room today, and we're very grateful that you took your morning or evening or afternoon to spend with us as we heard from LaFleur, we heard from Tawny, we heard from Vidyarath, and we heard from Dr. Pauline Russell-Brown today on issues of gender and COVID-19 within the Caribbean. And so I'm going to hand over now to Makesi, who's going to share with you some upcoming information about the MenEngage closing ceremony and send us off in fine Caribbean style. Over to you, Makesi, and thanks again, everyone, for attending.
All right, so thank you, Tavia, for the engaging session. I really did love the energy. I'm grateful for the time all the presenters invested in making this session a success and a rewarding one. Tony-Ann Bodbrough, Pauline Russell-Brown, LaFleur Kwame, and Vidyarath Kisun, thank you, thank you, thank you. Your contributions were indeed insightful and left us with a lot to reflect on. I appreciate all who tuned in today and invite you to follow us on social media. As we leave, I would like to invite you to the closing event of MenEngage Ubuntu Symposium on the 22nd of June. The Ubuntu Symposium is about creating spaces for listening, critical reflection, and commitment to action crosswork to transform masculinities and engage men and boys for gender equality and social justice. Thank you so much once again for your time, and I hope to see you all again soon.